You are all welcome to the Health and Lifestyle Hour. My name is Dr. Hilary Ahayisibwe. I'm a gynecologist and obstetrician at New Care Clinic and Fertility Center, Bara. Today we are going to talk about cancer of the breast, one of the most common cancers. At least every one of us has had or has known someone who suffered from this very bad cancer, and together, especially in this month of October, we have been working hard to raise awareness about this cancer, and we are working hard to make sure that it stops being a leading cause of cancer deaths among our women. We know that worldwide, cancer of the breast is the leading cancer among women, but of course in our settings in Uganda and other sub-Saharan African countries, we know it comes slightly after cancer of the cervix. So cancer of the breast is very common in our setting. We see a number of women coming with this cancer, but the biggest problem has been that these women present when it is too late, and therefore when nothing much can be done. We have maybe all of us contributed to campaigns, we have performed car washes, we've tried to sponsor people who are battling this cancer and therefore seeking treatment. For us on this other side of the world, we have been involved in screening, we have been involved in treatment, and we have been involved in surgery of this cancer, and unfortunately we have fought a lot of battles. Some have been won, some have been lost in as regards this cancer. So when you talk about cancer of the breast, we are meaning a malignancy or a cancer that affects cells of the breast. What happens is that the particular cells in the breast, and as we shall see, or as we may want to know, that cancer of the breast is not one particular cancer. There are a number of cancers that affect the cells of the breasts. Depending on which cancer affects the breasts, the cells will start growing uncontrollably, therefore resulting into a sequelae or resulting into what we are going to look at as cancer. And that brings us to the signs and symptoms of cancer. For many women, the first symptom they will feel is feeling of a mass in the breast. Usually it will be one breast. It starts as a painless mass that will start increasing in size, and for some, the mass may become or may get painful. Another sign is an abnormal discharge from the nipple. So for a number of women, they will see a bloody discharge or even a milky discharge from the nipples. Usually with cancer, it may be one breast that is affected. So for some, that abnormal discharge is the first thing they are going to see, and it will herald a new battle with cancer. Pain and swelling of the breasts are also common as signs and symptoms. Then for a number, there may be changes on the skin surrounding the breast. It gets that orange, like we all know that cover, the skin of an orange, the way it is made. Such an appearance can happen on the affected breast, and that too will herald or will signify the potential for cancer of the breast. Now, that's called pseudorange. Now, for others, a few people, their first time to suspect cancer will be when there is nipple retraction. Someone who has had previously normal breasts, normal nipples, now has them retracted inside. And that is also what can get us to suspect that there is a cancer. For a good number of other women, they will get ulcerations or wounds on the breast. Others will get lightening or change of the color of the skin overlying the breast, change in size or swelling of the breast as the signs for breast cancer. Before I delve so much into cancer of the breast, I want to emphasize two things. One, that cancer of the breasts affects both men and women, though it is more common in women than men, but the men are not spared either. They can also get this cancer of the breast. Two, when we talk about cancer of the breast, we're not talking about one disease. We're talking about a spectrum or a number of cancers that can affect the breast. Of course, since this is not a scientific session and this recording is meant for the patient out there, for an attendant out there, for a woman or someone interested in cancer out there, I won't go so much into the scientific nomenclatures of these cancers. There are a number of risk factors that we know which predispose to cancer of the breasts. One being a woman, because we already saw that even men can get, but if one is a woman, they have higher chances of getting cancer of the breast. History of smoking, family history of breast cancer. If one's relatives, an auntie or a mother, a grandparent has had cancer of the breast, this person stands the risk of developing cancer of the breast. People who are obese, that is obesity. People who have had delayed menopause, in that someone, instead of going menopause between 45, 55 years, they are 55 and they're still giving birth, they are still seeing their menses, they are not yet into menopause, they are 57, 58. Those ones also stand a high risk of getting this cancer of the breast. People who are obese, people who have history of alcohol intake, use of some drugs, especially now among menopausal women, those who use what we call hormonal replacement therapy, they too stand a high risk of developing cancer of the breast. There are quite a number of risk factors, a few that we have talked about. I would just encourage us to really look out for those common ones. And since we may be interested in how to prevent this cancer from happening, we know you have to limit some of this. Mothers who have had, let's say, few children, or who had their first pregnancy quite at a later age, those also are at a slightly increased risk of developing cancer of the breast. So how are you going to prevent cancer of the breast? One tested and acceptable method of prevention is screening for cancer of the breast. Now, screening helps us in two ways. It's going to help in early detection of the cancer, and if well and early detected, that means it is curable. The treatments available are able to treat it. And the commonest and free method is performing the self breast exam. I'll give that a minute. In the self-breast exam, we prefer women do it every month, preferably shortly after their periods. You stand in front of the mirror, put one arm up just above your head, the way I've done mine, while in the mirror. Use the opposite hand to examine the opposite breast. So if I put my right arm up above my head like this, that means I'm going to examine the breast on that side, moving in a circular motion, starting from the nipple. And what I'm doing, I'm looking for any masses or any lumps in the breast. Then you put the other arm and repeat the same. Move in a circular motion right from the nipple around the whole circumference of the breast. That is self-breast exam. If you have a mirror in the bathroom, you start by looking at the breasts. Look at them. The overlying skin, does it to you look usual? Does it look normal? Are the breasts symmetrical? Are they equal in size? How are the nipples? Are they indrawn or are they retracted inside? And if the answer is yes or no, or if one during this procedure of self-breast exam finds that there is something unusual or abnormal in their breast, it's at that point that they have to go and visit their doctor. Now, we also get to a level of what we call the mammogram. The mammograms are available. I compared it to the disease that we're talking about. The test is affordable. In our setting here, it costs around 50,000 shillings, and which I think really it's a worthwhile investment. So at least once every year, one can have a mammogram performed on themselves for early detection of the cancer, because we have agreed that early detection of the cancer ensures it being curable. There are other advanced tests. Ultrasound scan, it's doable. Also cost friendly in our settings, around 20,000, 30, 50,000, and I think that's an investment that one really can gently can invest in. One can invest in that. Then there are those moments when now someone has come in, they have a breast in the lump. What is your doctor going to do for you? The doctor may ask for a fine needle aspiration biopsy to confirm whether that mass or that lump in the breast is cancerous, which is just a swelling. Some women have benign swellings in the breast. They are not cancer, or even young girls. So as long as we do a fine needle aspiration biopsy, that is an office procedure done in a visit, takes a short time, and after it's done, you go home, await your histology results, confirm negative or positive for cancer. The doctor, of course, will examine you to see the extent of the breast masses. They will perform a general exam, see if there are lymph nodes in the armpits, lymph nodes anywhere, determine the intensity of the pain. That too is going to help the patient seek care. For those who already have cancer of the breast, it is not always an end in itself. Surgery is available. In most cases, if advanced, we do what we call the radical mastectomy. This is a procedure that actually excises off one's breasts and ensures that all the lymph nodes or any areas suspected to have cancer are removed. Well, of course, some women fear. They feel they want to die with their breasts. But science, especially cosmetic surgery and plastic surgery, have gone to a level where we can give someone a semblance of breasts. But at least they will live. They will live, see another day. They will live to see another year following treatment. Again, if advanced, the doctor may require to do X-rays to be sure the extent of the disease. So as we said, this is a very invasive cancer of the breast, and the earlier one gets to diagnose it, the better. How are you going to prevent cancer of the breast or cancers of the breast? One, avoid the risk factors we talked about. If you're a smoker, you must stop smoking. If you're overweight, get more active, cut weight. Don't use, for those, our mothers, our grandparents who are older and are in menopause, avoid the hormonal replacement therapies. If you must use them, they must be prescribed by a medical doctor who is well qualified to offer those. The drugs I'm talking about are those hormones like estrogen that we may give to women in menopause to alleviate some of the menopause symptoms. Not be good. If one drinks alcohol, stop it. If you have history of cancer in the family, that's the more reason why you have to test every day, or as we've said, every month, by doing the self-breast exam, so that if it is discovered early, then you're handled. We are able now to do tumor markers. These are tests that will be able to identify that, yes, someone stands a risk for cancer. Tumor markers like BRCA1 and 2 have been useful in predicting the likelihood of cancer of the breast. In some countries, people who stand these risks just walk into the hospital and ask, doctor, I want my breast off. Why? Because we have family history, and that's what the doctor now will do, is to determine the presence of those tumor markers. I think that is majorly what we need about cancer, the rest for today. So this show is sponsored by NeoCare Clinic and Fertility Center, Mbarara. We are a leading fertility center that offers IVF, in vitro fertilization services. We offer ICSI, intracytoplasmic sperm injection services. That is advanced technology, and as far as fertility treatments are concerned, but also offers even simple and scientifically proven methods of fertility treatment that have appeared as effective. Thank you. You are all welcome to the Health and Lifestyle Hour. My name is Dr.